Welcome to TSIB Talks, where we share information on construction insurance and its possible effect on your business. Enjoy our latest episode.
Welcome back to another episode of TSIB Talks. Today we are joined by Lydia and Scott. Do you guys want to take a quick moment to introduce yourselves?
Sure. Hi, I'm Scott Robinson, Risk Manager with TSIB. I've been with TSIB for 6 years and in the insurance industry for 13.
Hi, Lydia Levine. I'm the National Director of Workers' Compensation with TSIB for 7 years and in the insurance industry for 23.
Well, thank you guys so much for being here. To kick things off, let's start with our first question. What is active caring in insurance and claims management, and why does it matter?
So active caring in insurance and claims management is cultivating a workplace and post-accident environment where worker safety and wellness are the highest priorities. TSIB, along with their largest GC clients, have implemented a holistic and well-rounded approach to active caring for all employees and trade partners as it relates to claims and preventing accidents. From the beginning of a project to the end, and through the times of unfortunate accidents, we recognize the value that active caring brings to construction workers feeling safe on the job site. It's critical that all of our construction workers are cared for on a project because then they not only feel cared for, they feel confident about asking questions and asking for help, and also speaking up when they see something that presents a risk to themselves or others. To do this, we are committed to working with all stakeholders, vendors, and trade partners on our projects to create a unified approach to active caring.
I totally agree with everything Scott just said. My team's approach to active caring focuses on worker wellness, both pre-injury and post-injury. This approach requires full commitment from all our carriers, trade partners, vendors, every step of the way. We have to challenge them to go above and beyond to better care for our workers.
Now, you just mentioned two approaches to active caring, pre-injury and post-injury. Can you tell us a little bit more about each approach?
Sure. I can start with the pre-injury active caring. First and foremost, on every project, active caring starts with two things: getting buy-in from all stakeholders and creating the right environment. Engagement and participation from all stakeholders supports our goal of providing the highest standard of prevention and care for all workers on our projects. Creating the right environment where workers are treated fairly and with respect is critical. Empowering the workforce to hold each other and themselves accountable for safety on site goes a long way. We believe these initiatives create a safer workplace where the focus is on making the worker feel valued and cared for. Some of the services we work with our clients to provide on their projects are on-site wellness programs and trainings. We like to offer free wellness checks to workers. This includes blood pressure checks, glucose screenings, BMI screenings, nutrition consultations, flu vaccines, and more. This can alert a worker to a potential health issue or risk that they can then go to their primary care physician to have addressed and treated. This is very well received by the workforce in my experience. Workers are very grateful for these services being offered on site as it shows our commitment to their health and wellness. We have several trainings we encourage our clients to offer. First, athletic trainers are utilized to provide ergonomics training. Early detection of ergonomic issues, poor body mechanics, and discomfort issues will help reduce the frequency and severity of work-related injuries. Mental health awareness training is key. For this type, the project staff is trained to identify potential mental health crisis and offer connections to mental health services. This provides support and access to care that workers on a job site may not have had otherwise and can save a life. Additionally, their clients can work with vendors to offer educational training on nutrition, hypertension, diabetes prevention, and CPR training.
To add to what Scott said about mental health trainings, we also strive to increase our clients' mental health awareness on job sites. Workers who feel supported are more likely to feel gratitude, which creates less stress and improves their mental and physical health overall. I have also seen some clients hold health events on their projects, such as quarterly health fairs or lunch and learns on specific health topics. Again, these types of events are all well received by the workers. Now, let's get into some post-injury active caring initiatives. When an incident occurs and a worker has been injured, we immediately set out to determine what actions can be taken to address the injured worker's fears, anxieties, coping skills, and concerns over supporting their family while out of work and undergoing the necessary medical treatment for their injuries. It is critical to show empathy and care for the injured worker and their family. The key is to focus on the individual needs of each injured worker and identify how best we can support them. One of the things we have done for our clients is to establish an enhanced program with one of our nurse case management vendors. The program was set up to ensure that a field nurse case manager is available on an emergency basis to be dispatched to a hospital with the intent of not only making sure the injured worker gets the best possible care and appropriate medical treatment as quickly as possible, but is also provided emotional support they deserve. This has proven to be a meaningful program that we are proud of. Let me give you an example as to why. We had an injured worker who required emergency surgery for a fractured leg and had no family to be there with him and support him at the hospital. The nurse case manager that we sent to the hospital was able to comfort and console the injured worker in a way that he was very appreciative for. And basically, he broke down in tears and hugged her and said, "Thank God for you, because I wouldn't have made it through this without you," because he had no one else. He didn't have family or anybody to be there with him. This is a perfect example of why this program is so important. So many people don't have family and support, and we provide them with that through these nurse case managers. We recommend our clients make it standard practice for the on-site medics or a member of the project team to accompany injured workers who have an injury that requires emergency medical treatment to the hospital. They will stay with the injured worker until either a nurse case manager or a family member arrives. That is followed by daily contact with the injured worker for the initial recovery period, showing care for their well-being and being a resource to assist them with medical needs. Another important program we recommend is a modified duty return to work program. This program ensures all workers are able to return to work in any capacity as soon as they are medically cleared to do so by their treating doctor. Getting them back to work early is directly tied to improved mental health, faster recovery, and financial stability. My claims team works to facilitate communication between project staff, trade partners, and the carrier to ensure the return to work program is adhered to.
I think the positive effect that these programs have are on the workers at the job site and on the insurance program itself. With regard to workers at the job site, we see improved morale, improved cooperation when reporting claims, and better emergency response and support. For the insurance program, we see less IBNR, which is incurred but not reported losses, after project completion, fewer medical-only claims due to care rendered on site, and improved medical outcomes with early return to work, which leads to reduced overall claims costs.
Okay, so has the rest of the construction risk management industry brought into this philosophy as well?
Yes, to a certain degree. Cost is usually the constraint, but we're seeing more and more of our GC clients and developers implement medics on site, extras out of the workers' compensation program, like the nurse case manager that we spoke about before. So yes, we are starting to see it. I do think that TSIB and their partners produce the best programs in the industry, but we're starting to see more of that across the board.
Active caring in insurance and claims management is cultivating the workplace, right, and post-accident environment where worker safety and wellness are the highest priority. We strive to help our clients every day achieve that and make sure that their workers are taken care of in the best possible way and feel like they're coming to work and going home every day, working, on a job site where they're cared about and, their well-being is the utmost importance to our clients.
I totally agree with everything you just said. And it does seem like active caring is very important in making sure that the clients and the workers are taken care of every day. Now, unfortunately, that is all the time that we have today. So I just want to say again, thank you guys so much for being on today's episode. And I'm looking forward to having you guys back on the show again.
Thank you so much, Dom.
Yeah, thanks for having us, Dom. Really appreciate the opportunity to have the conversation and talk more about this.
Thanks for listening to this episode of TSIB Talks. If you like this content, be sure to follow for new episodes. Until next time.